The Health Professionals in Rheumatology Committee works in several ways, in several fields, namely promoting research and science, also promoting educational activities, and very importantly promoting implementation of the science. And we are not working well if we do not are able to bring what we produce here into the national countries, into the local hospitals, bringing the new discoveries into people, bringing the competencies developed into the service of the patients. There's 35 years of working together and collaboratively, and during this period we were able to, for instance, to work on more than 10 recommendations and points to consider publications. We were able to set up different educational activities, namely Teach-the-Teacher course or the online course, which is in his 8th edition. We have now postgraduate courses, courses on evidence-based medicine, and we have also been promoting the networking among health professionals, but also between health professionals and rheumatologists and patients. And one of the big achievements has been the capacitation and involvement of health professionals associations, national associations. We have had 25. Some difficulties are now being faced by some, but we are putting our energy to keep the national associations and the individual members participating in our activities, not only during the EULAR, but also participating in joint projects, educational, scientific ones, and having people learning from each other. And we have promoting educational visits, which is also a very, very good service that we want to keep providing. Our vision can be that every single person who is diagnosed with rheumatic and musculoskeletal diseases has easy and continuous access to health professionals in rheumatology, and to help them to decrease the impact of the disease and to have a better quality of life. If we achieve that, we will be very, very happy. EULAR is the structure, provides the structure, the organization and the support to have our activities. Without EULAR we would haven't have achieved this success. I'm not sure if EULAR is the only one, but is for sure one of the few medical structures that provides such kind of support and has this very, very deep interconnection between the rheumatologists, the health professionals and the patients. And I think this is an very extreme good example for other medical areas and for everyone. At the first time you may think that the Congress is important to learn about the updates on the treatments, on the strategies, etc., and which is true, but this also represents a great opportunity for networking, to have people sitting together and thinking on ways to change the future, namely the study groups, or to meet with colleagues from other continents. Nowadays it's easier with the virtual technologies, but still this is the major event to know how you are doing in your country. What are your difficulties? How did you overcome those? How can I implement those? And we know that having a coffee and having a good talk is sometimes much more important than hours of conversation, more formal conversation. And the Congress is the main opportunity for that. This year, like in previous, we have 14 brilliant sessions with different topics. We tested different models, namely a quiz game, and I invite you all to join or to see the record of that session, in which we will test a multidisciplinary game with a psychologist, a nurse, an occupational therapist, a physiotherapist, and a rheumatologist, and we will have fictional cases, and we will see how the specialists would propose which management strategies they would propose. And this is nice because it can be transposable to the national countries. We have also a special session on keeping the dark clouds away, addressing the psychological distress. And it will be on the Saturday, and it will be an amazing session. We will also address the implementation issues, how it's difficult to close the gap between research and practice. We will also have a session that discusses the interconnection between the health sector and the social sector, because we are health professionals, but in many countries both sectors have different budgets, and it's difficult for health professionals and professionals from the social area to work together and to align the strategies. And this is a huge need that needs to be addressed. And we will have sessions on pain management and non-pharmacological management of skin problems in people with connective tissue diseases. So I invite you to choose at least 5 or 6, and if you are not able to attend all, you will have the recording, and every time you can contact with us and propose with new sessions and new formats. We will be very willing to accept your comments and suggestions.